Hi guys, it's Dr. Margot Emami from RAMD. Now, you know I'm going to do this Get Healthy, Get Fit starting next week. And I talked a little bit about the prolonged fasting mimicking diet that I'm going to be doing with it because I really want to get rid of a little extra pounds around the middle that I gained with my sprained ankle and working a lot and not getting out there and being able to do all the things that I usually do. So I want to jumpstart myself into the swing of the summer and feel a little bit better about things. So one of the areas that I struggle with, especially after passing certain milestones in my life, is belly fat, kind of the dreaded belly fat. And it doesn't matter sometimes how much you work out or how fit you are, it's really hard to lose that. So we're going to be using the prolonged diet to help with the belly fat loss, but also I want to tighten that area. And anyone who's had a child knows that, you get a little bit of what we call rectus diastasis, or a little bit of weakening and splitting of those rectus muscles. It's a little bit harder to kind of bring in those obliques and kind of get that nice hourglass figure, or for guys, even that cut six-pack that you're looking for. So AccuFit is direct muscle stimulation that's going to run me through a set of 4 different exercises. I'm going to be working on my obliques with twisting and stretching. I'm going to be working on a hold pattern, much like doing a plank. I'm going to be working on a relaxation phase so that I don't build up any lactic acid. And I am gonna, in 30 minutes, do almost 70,000 reps. That's pretty amazing. That's not something that any human can do on their own. So I love AccuFit. It feels amazing. It's really kind of a relaxing feeling. Once you get used to it, there's no discomfort at all. Once you get used to kind of running through the 4 sets of exercises, then you kind of relax into it and it feels really good. You could even fall asleep. So we do this in 4 sessions. They are done 48 hours apart, although you could do it twice a week if you wanted, or you could even do it once a week if you wanted. But since I'm pairing it with my prolonged diet, I'm gonna do the sessions 48 hours apart. It typically takes 4 to 6 sessions. If you're wanting to tighten up a little bit and you're on the thinner side, you have really good muscle mass, 4 sessions may be enough. If maybe you have some stomach or muscle laxity and you haven't worked out in a while and we need to really kind of get you back up to speed, then I would recommend 6 sessions. So I'm gonna start with 4 sessions. I'm gonna do them 48 hours apart with my prolonged diet. So it's gonna take me Monday, Wednesday, Friday, during those that week of the 5 days that I'm going to be doing my prolonged, and then I'm going to do an extra session the following Monday for my 4th session. Now, I want to do my abs because I really love having that nice, not just the 6-pack. For me, it's all about the obliques and it's all about bringing in the waist. So I really love that look. I love feeling like it's all just held in there firmly. So I'm going to be doing my abs, but also I'm going to be doing my glutes. Why? Because we all like it a little up there. And as we know, we love gravity and that it keeps our feet firmly planted on the ground, but we don't like it when other things are going in that direction faster than we want them to. So I'm also going to be doing AccuFit on the backside to help get it nice and tight and lifted. And if that's not your problem, you can do it anywhere. You can do the legs, the arms, the back. It's really versatile. And so in 30 minutes, you can run through a complete workout of any area. And if you wanted to do a couple areas in a sitting, it's a 60-minute office visit. It's painless, it's quick. There's no prep, there's no downtime. And guess what? There's absolutely no soreness, none. And it's going to increase your stamina, your strength, your muscle size, your lean body mass. So not only are you going to look better, but you're going to be stronger. Now, I tried this out before, prior to me doing this series, and even after 1 treatment, I noticed an immediate increase in my strength, which was amazing to me because it made my ab workout so much more pleasant. When we feel strong, then we enjoy what we're doing. And when you feel strong, you can do more. There were exercises that I couldn't do before. You know, I'm a yogi, I've done it for 20 years, but the exercise I struggle with, the yoga pose I struggle with is boat pose. Oh my gosh, it's so hard for me. Every time we get to that point of boat pose, I just want to lay down. But after doing one session of AccuFit, when I was demoing the technology, I held boat pose like it was nothing. And I couldn't believe it. That sold me on the technology. So I'm not going to tell you do just one treatment. We really know the science is you need to do about 4 to 6 to really get sustained muscle growth, which takes a few weeks to see the muscle growth. You're going to notice strength and stamina increasing immediately, but then kind of that six-pack and the muscle growth is going to take about 8 to 10 weeks. And then we really recommend that you kind of maintain it. So you can choose how often you want to maintain it. Maybe come in every couple of weeks or once a month for a session, just to give that muscle memory to kind of get those muscles tight and strong again. So I'm really looking forward to my 4 sessions, and you'll get to see what it's like to go through those with me, and I hope you'll find it as interesting as I do. I'm really, really excited about this technology. I've looked at everything that's on the market today. There's about 5 different machines on the market today that are well known. I really studied this, the fine-tooth comb detail. I looked at everything, and I found that this technology was absolutely the best, the most effective. It really works, and it's also FDA approved for pain control. So if you have an injury, if we're rehabbing something, if you have trigger points, if you're dealing with pain in some area, this is also really effective. We can treat one side of the body different than the other side of the body, so you can change the controls and how much we do the workout. So one side of the body we could do pain management on, and the other side we could do strengthening on, or vice versa. If you have a meniscal tear or an injury and you're trying to rehab something, you can work on that. If you're a weekend athlete and you just want to get stronger, or if you're a professional athlete and you want to get that extra little edge, AccuFit will do that for you. That's what's so amazing. So whether you have trouble getting off the couch or getting out of a car and you really need to get some strength and you're not able to work out for whatever an injury or age, AccuFit can help give you the strength to do functional life activities. Or if you're having a little bit of discomfort or pain or struggling from trigger points or something along those lines, AccuFit can help with your pain management protocols. And if you're wanting to build muscle, build strength, get a mommy makeover, AccuFit can help. Or if you're really an elite athlete and you just want to push it that much further, triathlete, running a marathon, professional sports, golf, tennis, we can really tune it to whatever your sport is so you get the maximum advantage for your performance. So incredibly versatile. I don't know any other technology on the market today that can do those things to that extent, and that's why I really love this technology. So I'm going to be showing you the basics, the abs and the glutes, but there's so much more to it. So if you're interested in learning more, please make an appointment. I'm happy to do a consultation and give you all the information that you might need to see if it's a good treatment for you. So looking forward to sharing more with you next week as I start my journey. And in the meantime, once again, this is Dr. Margot Emami of RAMD.